shown my hand yet. Here's my hand. We're on our way to Dr. Rockwell, his office, to take off the bandage for the first time, which I'm really scared to do because it really, really hurts to take it off, more than surgery, I'm sure. And so I guess I'll recap. I had surgery last Friday. Today's Thursday, so it's been almost a week. And I look like I want to punch you out, right? And Katie's driving me. Taylor has to work again.
Hi, friends.
I would show you, but I only have so many hands to work with. But so Katie and my mom and Taylor have all talked me into talking to Dr. Rockwell about my bad experience with the anesthesiologist. It's not how it turned out that's bad, but how it could have turned out that is bad, because it's really, really wrong that we made a special effort to tell them about ED, and so that they would be prepared to know that this was a special case. It wasn't just anybody that they were laying their hands on, and the message did not get relayed. And really, it seemed like nobody had read my chart who entered the room, which, as I understand, I'm not a medical professional, but that seems to be just what you do before you see a patient. You have to know what you're dealing with. So I'd requested that they had a special airway, the smallest airway on hand in case they needed to intubate me in case of an emergency. Had there been an emergency, and had they shoved a regular size airway through my mouth and throat, it could have killed me. But I am really afraid to complain, because I know that doctors will hesitate to work on somebody in a condition like mine because they are not experienced, and I don't want that either. I don't want people to not want to work on me because they're afraid. But I just asked a few simple things, and none of those things were done. So I don't feel like I'm complaining and needing all these extra things. I just asked for some specific things that weren't done.
You know, Jameson, I'm also sure that one of the things you would have had to sign the other day was, your patient's rights. And in that, it would have said that you would have every right to, like if something was done that wasn't right to you, you have the right to complain. Like all of those kinds of things are in there. I'm sure they didn't tell you exactly what you were signing, but it would have been covered. So you have every right to do that. But you are right. I mean, you don't want to jeopardize your care either.
You don't want to upset the anesthesiologist. Well, we're almost there, so I'll let you know how it goes. And meanwhile, I put together a little clip for you of our friend Monsie, who came out here a couple weeks ago for a procedure, and she had some problems with the anesthesiologist, which will illustrate to you again why I am afraid to complain, because this could happen to me.
The day before my oral surgery, I got a telephone call for Dr. Taylor saying that the anesthesiologist that Children's had planned me with did not feel comfortable doing the procedure because he had read over my history of epidermolysis bullosa, and he didn't feel comfortable doing it. I drove all the way from Arizona, and it's a costly drive, and to hear that the day before, it was like, wow. I think what happened was they just planned me like if I were just, having a surgery and they didn't know that I had EB, and that posed a problem. And so he's like, no, I don't feel comfortable. And which I understand. You have to make sure, even for myself, that when you're planning a surgery, always make sure you're lined up with anesthesiologists that has experience or has studied epidermolysis bullosa and that has the confidence. Because if you are traveling, or just not even traveling, just even in your own state, and you find out the day before and you're prepared, for your surgery, that a doctor's not willing to work on you, you might not get worked on. They might not find another doctor within the time frame you need to have surgery, because you could be either in pain, you could have a serious infection or something, So it's really important to make phone calls and make sure you're lined up with a doctor and they know. And it's very important also not to, because she had mentioned, talking him into it, but then she was like, no, because if a doctor doesn't feel confident enough and then talking them into it, it raises a lot of nerves, and I've been through it before. And I'll give an example. In Los Angeles, Children's Hospital of Los Angeles, I had one anesthesiologist that did not feel comfortable doing my case, but he didn't say it to me. I saw it in his face, and this is very important. If you feel that a doctor is not eye to eye with you, ask them. Get another anesthesiologist, because there are several anesthesiologists working sometimes. It's worth finding a doctor that has more experience, because it's very costly. Because what happened to me was he was upset and he took it out on me, and he didn't tell me he was going to give me certain meds. He shot meds into my IV, and I didn't know it at the time, and I freaked out, and then my body was getting very cold, and my mom was freaking out and everything, and then he just rushed me into the OR, and they were doing a nerve block on me, and he did not line me up properly, and he put the needle in my back several times, and he couldn't find the proper space, and his nerves were just all on edge, and he finally had to try it again, and I was black and blue, and he bruised my spinal cord, and I came home and I had a huge black and blue mark on my back that didn't go away for months, and I could hardly take showers because when the water beat on it, it hurt so bad. You have to talk up and not be afraid, of doctors. Just because they've gone to school 10 years doesn't mean you don't speak up. You have to.